My name is Muhammad Asif, and I am an emergency first responder. With a strong commitment to saving lives and providing critical care during emergencies, today's topic is what is poisoning emergency? An illness caused by eating, drinking, or breathing a dangerous substance. Poisons can be swallowed, inhaled, absorbed, or injected. Household products, such as cleaning agents, personal care and topical products, and pesticides, are among the top 10 substances responsible for poisoning exposures annually. Occupational poisonings occur from exposures to a variety of chemicals. Swallowing a poisonous substance, spilling it on the skin, spraying or splashing it in the eye or inhaling it can all lead to poisoning. A child may also be poisoned if they are given the wrong medicine or a wrong dose of medicine. Always double-check the age and dosage instructions before giving medicine to children. Antidotes. These are substances that either prevent the poison from working or reverse its effects. Sedatives may be given if the person is agitated. A ventilator, breathing machine, may be used if the person stops breathing. Anti-epileptic medicine may be used if the person has seizures, fits. First steps. If the person inhaled poison, get him or her fresh air right away. If the person has poison on the skin, take off any clothing the poison touched. Rinse skin with running water for 15 to 20 minutes. If the person has poison in the eyes, rinse eyes with running water for 15 to 20 minutes. While signs and symptoms of poisoning can vary depending on the type and other factors, there are a few common symptoms to be aware of. Dizziness, disorientation, vomiting, trouble breathing, pain, headaches, feeling faint. Thank you for watching the video. Your support is appreciated. We hope you found the video enjoyable and informative. Stay tuned for more exciting content.